an ally, we can make use of that to make sure that the students can learn even better.
Well, I saw a lot of smiling faces when you said enemy. But thank you so much. It's so good to know about that. And my next question is, what are the healthcare challenges that India faces? Yes, sir, tell us your name and what, according to you, are the challenges that India faces at this point in time?
Good evening, everyone. I'm Dr. Akshay. And with regards to this question, actually, it would have to be a very long answer, but I'll try and keep it short. The first thing is, do we as a country prioritize health? The answer would be no. In addition to that, how is the level of awareness regarding what is good for health, what is not good for health, what are the important aspects of preventive measures or preventive medicine that we can take to make sure our health is kept intact. That awareness level is definitely low. And on top of that, in terms of delivering healthcare, when it comes to the rural areas where primary care delivery is definitely going to be lacking because of the load, because of our population, the size, and the deficiency of doctors to try and match up to that demand. On the other hand, in the urban areas, in the metropolitans, there's a lot of trust deficit with regards to the relationship between doctors and patients. It's not like what it might have been previously. So all around, there are a lot of health challenges that face our country today. So I think that should encapsulate most of the aspects that I would have wanted to say.
Thank you, Dr. Akshay, for sharing that with us. Well, I have one more question before we move on to a very, very interesting panel discussion. What are the changes that you noticed in the medical education and how far have we come? Yes, ma'am.
Yeah, from student point of view and teacher point of view. For students, the challenges are totally different from how we got trained. Okay? If we learned writing, then we came to Xerox, now it's pen drive to phone. So every information is available to the students. So one is that. But at the same time, healthcare is such a unique segment of the whole specialty where the human touch is so important. So making students competent enough with knowledge-wise is become easier now. If I was taking class for 250 in 2 batches, now I can reach to 2,500 in 1 session. So teaching for teachers has become easier. For students, evaluation has changed. You know, every student is used to now doing it on like digital. They study digital, they write their exams, and if we wrote essay questions, they are with MCQs. So learning modality has also changed, challenges also have changed. I think the best thing that happened in learning is access to digital learning. Okay, so, and this has to a large extent made learning more accessible. A student can get any information he wants, but most important, and the challenge for the teacher in training is to retain this human touch. You know, it's not just robotic, so we must teach them that you are the master, you take advantage of all the progress in digital. So finally decision making is clinician and the teacher, that's there. But take advantage of all that is available from the digital platform.
Thank you, ma'am. Thank you so much for sharing that with us.
And I think at least in medical education, probably India has done very well because the number of students getting access to this information is much more than many of the countries.
Well, ladies and gentlemen, on that note, for the next 13 minutes, we will embark on a journey into the ever-evolving landscape of medical education. Today, we will be discussing medical education in India, building competent and future-ready doctors for India and the world. So, let's delve in and explore the medical education landscape in India, India's healthcare challenges, and the need to have future-ready doctors, and the Gen Z MBBS student and digitization of education. Ladies and gentlemen, let's put our hands together and welcome our moderator on stage, Dr. Avantika Tomar. Please allow me to introduce you to our moderator. Dr. Avantika is a partner at EY Parthenon, and she has taught at UNSW and UTS in Australia and recently moved to India to follow her passion for the education sector. Currently, she is a guest faculty at prestigious business schools like IIM Calcutta, IIM Tirchi, and BITS in India. Please, let's once again give us a round of applause. A very warm welcome to you. Next up, I would like to invite our panelists here on stage. Mr. Ravi Panchanathan, requested to kindly join us on stage. He is the Managing Director and Chief Executive Officer of Manipal Global Education Services. He oversees 1,000+ crores Manipal Global Education Services with campuses in India, the Middle East, and Malaysia. He is an accomplished leader with a career spanning over 32 years. Mr. Ravi has experience in setting up new businesses and practices from scratch and building them into profitable businesses. He has worked with companies like Tata Motors, Hindustan Unilever Limited, Intel Corporation, and Infosys in the past. A very warm welcome to you, sir. And now I would like to invite Professor Monica Arora, the Vice President Research and Health Promotion. Please join us on stage, Professor Monica Arora. Oh, a very warm welcome to you, ma'am. She is a public health scientist working in the area of preventing and managing non-communicable diseases through health promotion and health advocacy. Dr. Monica has an experience of 24 years in public health research, practice, and training. She is the Director of Health Promotion Division and a professor at the Public Health Foundation of India. She has been honored with the Best Practices Award in Global Health in 2011 by the Global Health Council. A very warm welcome to you, ma'am. Next up, we have Mr. Sparsh Srivastava. He is a final year medical student, distinguished with 6 accolades over the last 3 years. His passion for medical education drives him to innovate in the realm of digital learning, aiming to enhance the study experience. He also previously served as an associate editor on KMC's editorial board, all while nurturing his interests in photography, exploration, and culinary delights. A very warm welcome to you. Next up, our last panelist for today, Mr. Suraj Hindiskere, requested to kindly join us on stage. He is a consultant orthopedic oncosurgeon at Sparsh Hospitals, Bangalore. He has over 7 years of experience in the surgical management of bone and soft tissue tumors. Dr. Suraj has an extensive training in performing complex tumor resections, and so far, he has handled over 3,000 bone and soft tissue tumor cases. A very warm welcome to all our panelists, and moderator, Dr. Avantika, over to you.
Hello. Can you hear me okay, everyone? Awesome. Thank you so much, Tejasvi. Thanks for that introduction. Welcome, everyone, panelists. Welcome, Monica, on video as well. Before we begin and delve into medical education, which is what the topic is for today, let me be that person who will give you, try and paint a picture of education as a sector in India. As Tejasvi said in my introduction, I work deeply on all sectors, all segments of education. So let me talk about the two big ones and make sure that everyone in the audience is, we're all on the same page when it comes to that challenge really, which was the first question in education as a sector in India. So the two big ones are obviously there is K-12, which is school education, and then there is higher education. Let me talk about, just spend a minute on each of these two, so just so that we get into the headspace of what we are going to talk about today. In K-12, in our country, there are 1.5 million schools in our country. There are roughly 280 million children who are in the school-going age group. Just again, to level set, if that was a country, it would be the 5th largest country in the world. Just our school-going children. 1.5 million schools, of which 1.1 million schools are actually government schools. The remaining are, of course, private, aided, unaided schools as well. The problem, however, when it comes to K-12 or school education is not of quantity, right? Because like I just rightly described, we have 1.5 million schools in the country. The problem is not of quantity, it is of quality. Flip to higher education, which is what we are here to discuss today. There are 1,100 universities. There are 43,000 colleges in our country. There are 11,000 institutes/academies. Here, we have a problem of quantity. Why? Because if we look at gross enrollment ratio, it's only sitting at about 27%. What that means is only 27% students who are in the age group of college-going kids, only 27% of them are actually enrolled in college. Any developed country, if we look at, I mean, I'm not even going to some of the ones that are absolutely stellar when it comes to GERs. Any developed country is at least sitting at a 50, 55, 60%, right? So we are just about halfway where we need to be from an enrollment standpoint. And now let me come back to medical education, therefore, right? So if we are saying for higher education, only 27 out of every 100 students who should be in college are in college. That's a problem, right? That's clearly an issue of quantity. I think some of the conversations we've had before have already kind of touched upon digital, and we'll talk to all four of you a lot about digital today as well, because can technology be a part of the solution, therefore, right? We have roughly 39 million children who are enrolled in colleges or universities today. We need to get that number up to 80 million. If we are serious about having an educated India, not just a young India, which is what, as a demographic dividend, we keep talking about how young our country is. Amazing, yes. We should all celebrate that. But we want it to be young, knowledgeable, and skilled. Then it's a party, right? Then it's something that we really have to celebrate. So how do we get to that part of knowledgeable and skilled as well, right? From a medical education standpoint, again, if I speak about some of the numbers, NEET UG, I think roughly 14 lakh students write that exam for 1 lakh seats, right? So we are at least 14, 15 times oversubscribed when it comes to medical education as well. There are 14, 15 percentage times more people who want to become the good doctors, better doctors that we were seeing in the address that Dr. Pai had than we have actually today, right? So in numbers terms, again, because medical seats are not enough, we are not doing great. The government, from their perspective, is obviously trying to do a lot. There is an announcement around every district should have a medical college. Historically, our regulations have been quite limiting, quite restrictive. More and more, we are seeing government take the initiative, public institutions take the initiatives that we should have a lot more medical colleges than we do today. The other change that's happening, and I'd love to hear from all four of you on this, is the competency-based medical education that has now come into play, right? And therefore, what we are doing is, and I think some of the speakers there said as well, Dr. Akshay, you also spoke about it, we don't want just knowledge. We want knowledge that can be applied in the form of skills, right? The way to make better doctors, the way to convert students like Sparsh into amazing doctors is if we can give them, if we can arm them with skills, not just knowledge, right? A healthy blend of both of them. So with that as the introduction, perhaps let me get started, and I have Lots of questions for all of you, so brace yourself. Let me come to Monica, you first, if that's all right. You have an experience of healthcare education and providing those services for, roughly 2 decades now. How do you see medical education changing in the country? What have you observed in these past 2 decades? Oh, I think we need to get her off mute. So sorry, Monica, bear with us for a second. Can you say something now?
Yeah, can you hear me now?
Yes, perfect. Please go on.
Great. Thank you very much for having me at this very important panel discussion. I would like to start with saying that over the past few years, medicine surely has evolved into a multidisciplinary field, from the earlier, which was a teacher-centric model, to more skill-based model. Also, MBBS students, postgraduates are now opting to pursue specialization in public health by opting for their master's or PhD in public health disciplines, which is very, very heartening, because there was an earlier discussion and a speaker mentioned that there is need to focus on prevention. So I would just like to expand this further to say definitely the future medical students as practicing doctors need to not only have a strong role on prevention, apart from treating and managing patients, but also focus to the current debate and discussion, which is around wellness. So promoting wellness will be a concept which we need to build into. So there have been changes. People have moved to having more practical skills, and learning styles of students have changed over the years. Many doctors are contributing to having not only lucrative careers as young medical professionals, but they are also contributing to not only patient care, but population health, and thinking about areas where they can be seen not only as public health entrepreneurs, but are also looking at starting up the new startups, like there is focus at AIIMS Delhi now to introduce startup policies to promote entrepreneurship among medical students in collaboration with IIT, IIMs, and other consultancy groups. So I see a lot of progress which has changed the medical education in the past 20 years. Thank you.
Excellent. Thanks so much for that, Monica. Suraj, can I come to you next? Perhaps the same question, but just from the perspective of a practicing doctor. What would you say? How has medical education transformed?
So like Monica just explained how the landscape has changed. A lot of changes has been seen with respect to the delivery of the medical education itself. One of the doctors rightly pointed out when you asked them what was the difficulty which they face on a day-to-day basis while teaching a medical student. Over the past many years, we have seen that the way we teach and also how a medical student learns medicine has drastically changed. We have moved on significantly from an era of blackboard teaching to PowerPoint presentations to a lot of live virtual reality and mixed reality these days. So a huge shift has been seen with respect to how the students are taught medicine, which is very important, because it is on the onus has to lie with the teacher how to make a subject or a topic interesting to a student.
Yeah.
When there's a class of 50 students and you start teaching a topic, you should really make it interesting to make sure that the students is focused on that topic, which is not easy, but I'm sure with the help of technology these days, with a lot of audiovisual components in our teaching, it's going to improve a lot.
Absolutely, and I think even the gentleman there was talking about how it's becoming more and more difficult to retain the attention of students today. It is the Netflix generation, right? Oftentimes they find it hard enough to decide what to watch, yes? So it takes you 15 minutes, Sparsh, to even decide what do I want to watch right now, because you start something and you get bored in 3 minutes and then you stop and go on, right? So absolutely, I mean, as a business school faculty, I feel that myself, that every time I'm, lecturing, it's an act, it's a performance every time, because I have to keep engaging the student in different ways all the time, which is not how I felt 10 years ago when I first started teaching, right? Absolutely. Ravi, coming to you then, you see the business side of all of this, right? And therefore you see the resources that are required and how that has changed in medical education. So talk to us about, faculty, labs, any kind of equipment, all of this that is required. How has that been changing?
So good evening, everybody. From a resource lab perspective, let me deal with that first.
Sure.
A lot of things have changed. For example, earlier we had to have cadavers and all of that. Today there is a possibility, and there are changes that are happening where you can actually go online and look at some of these aspects of the cadaver. It's not that cadavers won't be required or they're not, but I'm saying the overemphasis on the availability of cadavers is possibly on its weaning away. That's on the one side. As far as the labs are concerned, a lot of technology has come in. Why labs? I mean, even if you take healthcare as a profession, if you take hospitals for that matter, the amount of technology that has gone through, the evolution of technology and all of that has really impacted and benefited patients and healthcare in a very large way. Coming back to faculty, I think it's like all of you are saying, right? The role of the faculty is really changing, right? It's not just about delivering out of a slide deck or what, but it's more about pointing students to where they should learn from. Pointing students to look at core, small, micro-learning elements which they can remember and which they can recall. So it's all about, like you said, the attention span is only that much.
Yeah.
How do you grab the eyeballs in that attention time will make you a good or a not so good teacher. Yeah. So I think faculty and teaching, the way faculty delivers lectures, the aid of technology in teaching, all of that is undergoing a change. The student also the learner is also seeing the change. The learner also feels very comfortable when things are being given to him in the way, the form and the form factor that he or she is used to doing. So therefore, I think it's a great time. It's a great time to see the shift from a traditional faculty to a digital faculty.
Absolutely. Perfect. Thanks so much. Sparsh, you're the student amongst us. I know we are all talking about the learner, the student. You're actually one. As a final year student at a fantastic institution like KMC, you of course you have the vantage point of seeing what all is actually happening and what resonates with you as a student. So talk to me about what shift have you seen in your last 3 years, 4 years of study, and what more would you like to see from medical education in India?
So being in KMC, I am privileged to do my MBBS from KMC Manipal. So it's one of the top 10 in India and very renowned internationally. So we in KMC, teaching is a priority, and the college also provides us with the infrastructure that enables it. So, but I know that in the it might not be the case everywhere. So right now, students look at learning in a different way, learning resources for that matter in a different way. We consume it from several points. It could be from our class lectures, clinics, textbooks, and online learning resources have come up in a big way. They right now, if not, they might not be more important than the other three, but they are almost at par as a student perspective. And students right now, they have a very clear path. They know their pathway ahead, and they also understand their learning style. So they look for a resource that suits them the best. And in terms of what changes that I have seen since I have started my MBBS journey is a great adaptation of the technological aspect of learning. So we are more and more dependent on aiding our knowledge from the online learning resources. But at the end, nothing can beat the bedside clinic. So that stays, and that will always be the prime. But we are definitely aiding it from the online resource perspective.
Perfect. And I think for all the educators in the audience, really the message that Sparsh is giving is that personalization is important, right? There is no one size fits all in education overall, certainly not in medical education. Every student is learning in his or her own way. And frankly, the pressure is back on us. It's back on the faculty to adapt to how each student learns differently, right? Now we can fight it. I can see a lot of you nodding in the audience. So that's great, because what I often feel with faculty and professors is they try to fight that. They say, no, but Hamare zamane mein, this is how we used to learn. No, but this is not your zamana, right? Students today do want to learn differently. It is, the onus is really back on the faculty, it's really back on people who are providing that digital or that technological enablement to start looking at each student differently, because each student is different, yeah. So let's talk about, great setup for medical education in India. Let's talk a little bit about the challenges as well before we go ahead. And I think Akshay here spoke to us about what are the challenges that a doctor faces. Clearly, COVID has been a very sobering experience, a very humbling experience, not just for our country, but the world at large, right? It has taught us a few things about how ill-equipped sometimes we were, and we perhaps still are, when it comes to healthcare in our country, right? So let's spend a little bit of time, panelists, if that's okay, on one, what are the challenges within healthcare in India? And two, therefore, what should a future-ready doctor look like? What should a doctor who knows how to deal with these challenges, what would that, I don't know, Doctor 4.0, right? How we have the Industrial Revolution 4.0. How would a medical doctor 4.0 look like? What should they do? How should they tackle some of these challenges that our country faces when it comes to healthcare, but also the world at large? Monica, again, if you don't mind, if I could start with you, what are these healthcare challenges?
So I would like to highlight some of the data here.
Sure.
We already know the non-communicable disease burden is huge already, and it's growing at a very alarming rate. So according to the Global Burden of Disease Studies, non-communicable diseases already contribute to 64% of deaths in India, and most of these deaths are preventable. So, which means with these growing numbers, already our health system is saturated. And as these numbers keep growing, no way the health system would be able to support treating these numbers. Whatever technological advancements, pharmacological advancements we must achieve, we will not be able to run against these growing numbers. So what we need to emphasize here is that yes, when we are looking at future ready doctors, they definitely have to start looking at patients from the point of view of giving them a decision-making power in their treatment. So with this growing condition, another problem that we see is people will be living with multiple long-term conditions. A diabetic patient would have cardiovascular disease, a psychiatric disease, or mental health issues. So we need to look at integrated responses from the health system. Currently, the demand from the patients are they have to go from one specialist to another. Even if it is a multidisciplinary hospital, they have to go into different departments. Whether there is a way to think about having integrated care for this individual in one setting rather than this person having to move from one specialist to another. Another issue I see is health systems need to be patient friendly. As I said, that the doctors need to be more cognizant to the patient's needs and meaningfully engage them in not only understanding their prognosis, but also the treatment pathways, and have a role in that management. Therefore, this will reduce the burden on the health systems and the doctors. So listening to patients with empathy, which is very difficult in knowing that doctors are very, very busy and have huge patient load. We'll have to think about how technology and other healthcare support system, having more healthcare professionals, support doctors to be able to effectively communicate with the patients in less time, but be effective communicators. So these soft skills are going to be very, very important. Thank you.
Great, thanks Monica, thanks for setting that up for us. So Suraj, let me come to you, right? I'm sure before coming to you, your patients have also
what will a medical student do with all this education? Knowledge is one part, but that's not enough. Along with knowledge, we have to know the attitude and an approach with which we go to a patient or treat a patient. Unfortunately, there's hardly anything at all in our curriculum where medical students are taught about empathy, like Monica mentioned, or about how to approach a patient. Actually, such things have been taught in the Western literature, like how do you break a bad news to a patient? How do you tell them that they're not going to live for long, or they have very little time, or they have a very morbid disease which cannot be treated? Such questions, or how to handle such situations, are unfortunately not treated at all in our curriculum at the present. So, getting knowledge is easier now. You can get the same knowledge with so much more less of energy. But what you ultimately do with that knowledge is the question. So we really have to train the medical students on how to approach patients and what they actually do with this information, so much of information what they have in handling a patient. This is one thing. Second thing, we spoke about, there are two things we need to, in medical education, the government has increased the number of undergraduate seats. There are more than 1 lakh plus undergraduate seats. So when you look at this issue from the outside, you feel nice because the doctor to patient ratio is coming down. There are more doctors which you think can cater to the patients, but nothing is being done with respect to the quality. We're only looking at the quantity of the seats, the number of doctors who can come out each year. But are you doing something about what is the basic requirement or the quality with which a doctor should graduate? Again, very little. So I feel that technology is one thing which can actually address both these issues. By the ways we teach a medical student on how to handle patients much better.
Yeah, and I think, Suraj, I'm completely with you. Technology is a great way to level set, right? Because the quality in different colleges for these 1 lakh seats that are there will be very varied. And I think no matter how hard we all try in this room, that variation of quality will remain in medical institutions. What technology can do is bring everyone up to a certain hygiene level, above which it's fine to have a quality difference. But our challenge in this country across education, across even, like I said, I look at K-12 also a lot, is exactly that problem. How do we lift up everybody to a certain level? And then it's fine to have some institutions doing a lot better job than the others. No problem at all. But we want a basic hygiene level of quality that our doctors have, not just on their medical knowledge and skills, but also on empathy, like you said. So, well said. Ravi, is that a future-ready doctor?
I'm actually a bit confused because I go to a doctor to make sure that if I have an ailment, they give me the right solution, right? To me, a future-ready doctor is somebody who empathy one side, wellness one side, bedside manners one side. Somebody who can actually not toss me around, right? So let's say I go for an ailment and then I'm kind of shifted to 3 different specialities or doctor sections and say, okay, fine, you do this test, this test, this test. So to me, a future-ready doctor has to be somebody who is able to connect the dots, and somebody who's able to say that, okay, fine, you come to me with this, these are the 3 things, do all of these 3 things, we'll figure out, and not toss me around and send me to 3 different specialties. So knowledge is an issue. The confidence of doctors is also an issue because today there's so much of data overload. The doctor possibly, or the student, I mean, I'm just talking on behalf of Sparsh, the avalanche of information that he has to go through, to sift through, to be able to come to some kind of a solution. Can we make it easier for them? Can we make sure that all the doctors who are graduating, not only from KMC, but from all the other 650 colleges, have got, like you said, a threshold of quality?
Yeah.
They've just not selected subjects to crack the exam and pass, but they've actually gone through and understood the concepts behind each and every one of those educations.
So Ravi is now entering a slightly difficult territory there. So well done. I'm pretty sure Suraj wants to respond to that. Why don't you go first and then Sparsh?
Yeah, so both are 2 different things, Ravi. So when you, how you handle a patient, all these things have to be taught to a medical student, I totally agree. But a patient cannot sit at home, talk to a doctor over the comm, and then give him all the details, and then give him all the scans, and then expect the doctor to come out with a solution or a diagnosis. So again, both are two different things. How a technology would actually help is maybe maybe helping the doctor in choosing the right scans or the tests or the treatment or investigation method before, maybe seeing you, or much earlier, with a whole lot of AI information available. So it's not going to replace the actual physical contact, touch, examination.
It's an aid.
But
It's an enabler,
aid,
not
yes,
a replacement.
Yes, it's definitely not a replacement.
Understood. Absolutely. So Sparsh, we are, again, as always, we are deciding your future right here on the stage. But tell us, everyone's talking about having the right knowledge, the right skills. You're a final year MBBS student. You'll go on to do your PG, hopefully. You'll become a great doctor. Are you confident you have those right knowledge and skills when you see yourself, your batchmates, students from other medical colleges? Are we giving the right aid to you, the right enablers to you?
Okay. So in the direction of what Dr. Monica and Dr. Suraj said, we have been given the knowledge, and knowledge has been imparted in the medical education system for a long time, and it's being done very well. What lacks, or what has been lacking, and we are seeing a shift towards that, is the skills. And moreover, in the department of skills, I personally feel, and what they both have touched upon, are the communication and the attitude skills. So that is really, really important, because that's how your knowledge and or your other skills gets translated into. Your patient will understand only what you tell them, and they might not. It also prevents them to misunderstand you. So that is a very important point, and we have a lot of technological aspect coming up that can be, like sir said, that maybe patient gets tossed around within among specialists. So maybe technology might help us with that, like AI coming up can help us. Can help a doctor maybe look at all the other kind of scan and aid them in making a diagnosis that is a more comprehensible diagnosis. But it's really important for us to have all the information, knowledge, the skills, so that we are ready to face the challenge when we join the workforce.
Perfect. No, well done, well said. He's anyway started us on the topic of technology, so might as well stay there and continue with it. And let me also switch the order. Ravi, why don't I come to you first? What is the technological advancement in medical education that you think will help Suraj more and more do his job, but more importantly help Sparsh and all the other students who are currently in medical colleges to become the future ready doctors that we want them to be? How is technology going to help?
So technology in education, I mean, if you really look at, if I was Sparsh or if I were a student, I would like to be, I'd like an aid or a tool which helps me prioritize and schedule my time, right? Medical education is a very taxing, it's very heavy. So if something could help me to schedule my time, if something could actually tell me that, look, out of say 21 subjects, I'm not good in 3. So how much more time should I spend on those 3 to be able to improve? Second. 3, if I can schedule my own tests, if I can schedule my own, configure my own tests to make sure that, I focus more on the areas and subjects that is one aid. If I can look at some analytics which will keep telling me how I'm improving day by day, so that's another aid. If I can get learning in small pitch sizes, and I talked about micro learning before, if something can come to me in a way, and it's always been proven that people remember things that they see, right? So if I can have nuggetized education in the form of small videos, if I can have aid which will help me, if I don't know something about, let's say, how the heart functions, and if there's a quick aid which I can repeatedly see once or twice or 3 times to be able to clear my concepts. So those are stuff that I would believe would reduce the stress and the tension that the students face, and possibly those would in a way aid healthcare and make them better doctors because they'll remember better.
Got it. Let me again pit you against each other here. The business guy is saying nuggetize education, micro learning, right? What about you, Suraj? I'm sure your medical education was different to how it happens today. So when a young doctor comes to you with this nugget form of education, right? Is that annoying? Is that irritating? Do you celebrate it? Do you learn from it?
Okay, so I'm actually with Ravi on this one.
Woohoo.
A lot of change, I'll just give you an example. Let's say that even the best of a professor finds it very hard to explain a medical student how a heart functions without showing him. You know, let's say that you give him a chalk, ask him to draw it like, you know, on the board, and then ask him to, you know, teach the student on how the heart functions. It's quite complex, not that simple. This is how medical education was not many decades ago, just a few years ago. So now we have reached a stage where PowerPoint presentation is routine. So there it's a lot more easier because you just have to play a video of how a heart is functioning. For a medical student, it's so much more easier to grasp or understand and how it functions. So we are at this level right now. So there's definitely a role of micro learning and technology when it comes to medical education. But that's not the end. Actually, we have reached a stage where a medical student can actually go to the hospital, ward, or even the classroom, sit with the HoloLens, with the patient's own heart, VR heart, which is in the HoloLens. So the patient can actually rotate the heart, stop the coronary flow at one point, and see what happens to the myocardium. So I'm not talking about future. A lot of places, this is how medicine is being taught, and I'm sure that there's a role of, you know, technology and also micro learning when it comes to medical education. Yes, the use of the advancement of technology in treatment or healthcare, it's an entirely different thing. I'm only talking about education. There's definitely a role. I would like to give one more example.
Sure.
So again, this is not the future. This is something which is being currently practiced in Chinese University of Hong Kong. A trainee walks into the ward. A patient has a since I deal with bone tumors, so a patient has a bone tumor in the bone, inside the leg. Obviously, you cannot see anything from the outside. The trainee is given a HoloLens. So that has the patient's CT and MRI fused inside the HoloLens. So when the trainee looks at the patient's leg, it is registered and the lens is taught which is the leg bone, which is a thigh bone. So the trainee can actually see the extent of the tumor. So this is the first part. Second, trainee is given a pen and asked to mark the line of incision or how he would want to operate tomorrow in the operating room to make sure that he gets the tumor out in one piece. Again, I'm not talking about the future. This is the present. This is what is being practiced right now.
So you're saying these trainees get to have a simulated version of when they become doctors and are operating themselves, they actually get a practice run almost.
Yes, of the surgery which is planned for tomorrow.
Brilliant, brilliant. Coming to you, tell me what are the advantages? You're a Gen Z, Gen X, Gen whatever you are, right? What are the advantages of this style of learning that already happens? But where do you feel perhaps technology does not have all the answers?
Okay. So first of all, what Dr. Suraj and Mr. Ravi mentioned, +1 to all of that, because that is actually what we need, and I'm very excited to see what he told about, because that really is very intuitive. So currently, the advantages are like I have the information of the world at my fingertips. Anytime I can access, even in the hospital when I'm with the professors on rounds. If something comes up that I do not know about, I can just look it up. And rather than taking a note of it and then going back trying to find it in a textbook, and high chance I forget by the time I reach. So that's a big point. But a disadvantage of this kind of luxury of choice is that we often find ourselves lost in the vast amount of information and the resources that are there, and at that time the accuracy and the credibility of the information is prime. So apart from that, what we are looking for is definitely something that is more ingestible, but it also aids when we are in the hospital. Like the information that we learn is almost similar to what we see in the patient, because once we see in the patients, it's very hard to forget.
Yeah, perfect. Monica, coming to you for the last question for this evening. And therefore, where are we headed, right? I think all the three panelists have spoken about technology, what it does today, how it helps not just the doctors but also the students. As an educator, tell us, what is the future?
So I would like to talk about the whole government's focus on digital health, telemedicine, and the maintenance of electronic databases as well of patients, which will be hugely beneficial to be able to make decisions. But also in practice, medical technology is now playing a very important role with electronic decision support systems, which makes diagnosis so much easier and standardized for doctors. They key in the symptoms, there is an algorithm which will give them the diagnosis, the treatment pathways, and what additional information needs to be given to the patient. So the whole process would become faster, and the doctors would be able to get more time to speak to the patients with this technological advancement where decision making is faster. Also, the rampant use of wearable devices, I think, will again be very, very helpful, where the doctors are able to inform patients about monitoring their blood pressure, maintaining blood pressure charts, and their oxygen levels and the like. So it becomes much easier for them to make quick decisions when the patients come to them with these records, which they would have maintained themselves. So I would just say that Gen Z definitely is technologically very, very advanced, but there is scope for a lot of innovation, which we as public health practitioners would want to see come from these young doctors, because they use technology and they'll come up with more innovations. Thank you.
Wonderful. Thanks so much, Monica. No pressure, Sparsh. We're all looking at you. But look, to summarize, I think one thing that all five of us definitely agree on is we need credible, precise medical knowledge, but also medical skills. And what seems to be the point where we all seem to agree is that digital does have a lot of those answers. To get all our students up to a certain level of that threshold, but also to get our medical colleges at that certain level of quality threshold, which we all need to be at. And then everything else becomes, an add-on or a top-up to already good medical education. So thank you so much for being a very patient audience. Panelists, thank you so much. It was very informative. I would love to see some of that technology coming from Chinese School of Hong Kong all the way through to India. And hopefully very soon our students will be learning through that technology as well. Thank you so much.
Thank you.
Wow, that was definitely a lot to take. Thank you, Avantika, for guiding us. And thank you, panelists. Can we have once more huge round of applause for all of them who just joined us on stage? And now, ladies and gentlemen, it's time that we've all been waiting for. Ladies and gentlemen, the moment is here. And are you ready? Wow, I absolutely love the energy, love the excitement. Ladies and gentlemen, I would like to invite on stage Mr. Ravi. Please join us. And Preeti, please join us on stage. Ladies and gentlemen, are we ready once more? All right, let's go. Well, ladies and gentlemen, Manipal Medace is finally here. And are we ready? Well, we had with us Mr. Ravi Panchanathan, the MD and CEO of Manipal Global, and Preeti Frederick, Head of Product Development and Marketing at Manipal Medace for the launch. So let's put our hands together for both of them. And I'm sure we are all waiting to know more about this, right? Before I invite Mr. Ravi back on stage, I would like to talk to you a little bit about Manipal's legacy. Manipal's legacy is rooted in the pursuit of knowledge, the passion for learning, and the dedication to improving lives through healthcare. We have the greatest minds in the country, world-class medical institutions, state-of-the-art hospitals, and today, we officially step into the digital learning space. Founded in 1953 as a modest college, a medical college in Manipal, Karnataka, it has since grown into a global education powerhouse with a strong focus on medical learning. When it comes to developing a medical learning app, Manipal Global is just the right fit. Without any further ado, ladies and gentlemen, let's put our hands together and welcome Mr. Ravi back on stage, and he will take us through more about the app.
Very good evening. Thank you all for being here today to witness this momentous occasion in the history of the Manipal Group. For over 6 decades, we have been in the forefront of medical education, nurturing the dreams of countless individuals who aspire to make a difference in the field of medicine. To our unwavering commitment to quality and excellence. A lot has happened over the last 6 decades. I'll have you know that 6 decades back and today, the number of medical colleges have gone up by 20x. The number of first-year students over the same period has gone up by about 13x. And very soon, don't be surprised, as soon as next year, the number of first-year students actually touches 125,000. We asked ourselves some key questions. We said, look, while all this is happening, a lot of technology advancement and a lot of tech has happened in the hospital per se. What about education? Has the same evolution or the same innovation happened in the medical education? The second question we asked ourselves is, how has the profile of learners changed over the last 60 years? Now, if you recall, I did say that Manipal has a 60-year, 6-decade kind of of knowing and working with students. Just imagine the number of students who have passed through the hallowed portals of KMC, Mangalore, or Manipal. Do we have, therefore, a good knowledge of how these learners have changed, how their profiles have changed over the years? Forget about last 60 years. Do we have knowledge of how the profile has changed over the last 10 years? And the third question we asked ourselves is, when it's very easy for somebody in class 7, 8, 9, and 10, the parents then put them into a coaching class or some other mechanism, and they're being told that, look, you'll be doctors tomorrow, you'll be engineers tomorrow, right? And they somehow crack these tests, these entrance exams, get a good rank, and land up in a place like Manipal or any of the other 650 colleges. And when they do that, and when they get face to face with the curriculum, with the concepts, of having to go through some 50,000 ebooks and videos and YouTube videos on top of what the faculty has to offer, just imagine what the student goes through. The student possibly goes through a moment when he asks himself the question, why am I here to do medicine in the first place? Because there's so much of overload of information. So as we stand here at the cusp of a new era, we realized that we have seen generations of learners pass through our institutions, each with their unique aspiration, each with their unique challenges, and we have evolved with them as Manipal. We have lived through those 60 years. We've understood what they're going through and what their ever-changing needs are, and we've been able to come up with a solution each and every one time. Why am I saying all this? Manipal Medace that we've just launched is the embodiment of this evolution. A product that seamlessly merges our profound expertise in medical education with our intimate understanding of learner needs and behaviors. It is just not another product. It is a culmination of dedication, research, and innovation. Today we proudly announce our foray into the world of learning and test prep applications, making a historic milestone in our journey. This initiative is not just special, it's groundbreaking. It's not merely a product launch. It's a pioneering strategic move that will redefine the way medical education is delivered and received. I've worked very closely with this particular project for the last 15 months, right from the creation of vision to the launch today. And I intend to continue seeing how this goes through over the next 1 year or so. It will not surprise you, or if it does surprise you, please let me know. In 15 months, we have been able to visualize, vision, and bring the product to launch, possibly something very unique. I don't know many other products in the edtech world where in 15 months, from vision to launch, and we're not talking about one product, we're talking about 2 products, we're talking about learn, and we are talking about test prep. And this would not have been possible. Of course, we had the vision, we had the will, and we wanted to do it. But I think I can see a lot of my partners, my agencies, a lot of my people who have worked with. And let me thank you for being with us for all these 15 months, taking all the pressure and ensuring that you stand with us. And I'm happy to see you today, that you are here today to share the launch, which is a record by any standard. So thank you very much. Let's together work towards a brighter and a more accessible future for medical education. Do enjoy the evening. All the very best.
Thank you, Mr. Ravi. And like he mentioned, 15 months from vision to reality, and we are here. And I just cannot imagine the hard work that went through to put this together. Not to forget the research, the brainstorming, the sleepless nights, and I'm sure we would all love to know more about this. Ladies and gentlemen, let's put our hands together and welcome on stage Preeti Frederick, the Head of Product Development and Marketing, Manipal Medace, and she will answer all these unanswered questions. Over to you, Preeti.
Check. Thanks, Tejasvi. Good evening, everyone, and thanks once again for making time to be with us today and spend your evening with us. I stand before you with a story to tell. Have you ever wondered how innovation takes shape, right? How does a simple idea blossom into something that can change lives? Well, a year ago, all of us at Manipal embarked on a journey to develop a product that transforms the landscape of medical education. But today, we stand before you with a product that's not just an app. It's a companion, it's a support system, and it's a guide for every aspiring doctor. The Medace journey began 15 months ago with a lot of curiosity, with research, and of course, with a relentless drive to make a difference. Over the last 15 odd months, we delved deep and figured out where the gaps were. And hence, the app's very foundation is rooted in a deep understanding of the needs of learners. It was not only about creating something for learners, it was about creating something with learners. All of us in the room understand the pressures, I think, that come with pursuing an MBBS degree. You know, we've been talking about it for most of the evening so far, right? But so do we, right? The constant struggle with endless exams, grappling with complex subjects, all to emerge a competent and knowledgeable and skilled doctor, right? But it's also a journey that demands unwavering dedication, and it's a journey that's anything but easy. But here's the thing, the student is not alone, because we are in this together with them. Medace will remain a student's constant companion, buddy and guide from the moment they step into med school up until they take the PG entrance exam. It will step in as someone that understands their struggles and lightens the load. With Manipal Medace, today we aim to offer every aspiring doctor with the tools they need to succeed. Our platform will offer a comprehensive suite of resources, from top-tier learning materials to cutting-edge test preparation, all meticulously designed to cater to the unique needs of learners. To us, Medace is not just a product. It's a labor of love, it's a revolution, and tonight we are thrilled to have you as part of this remarkable journey. Together, we will set new standards, empower countless students to realize their dreams in the field of medical education. And now, let's see how we plan to make that happen. It gives me immense pleasure to invite on stage my colleague Anjita Sinha, who will walk you through our Learn offering, and she will be followed by Naren Reddy, who will demonstrate our prep offering. Over to you, Anjita.
Meghna, come. Thank you, Preeti. Good evening, everybody. I'm Anjita, and over the 10 to 15 minutes, me and my colleague, Meghna, will run you through the basic distilled essence of this product, that is basic sciences. Okay, we have a PPT also. Meghna, can you start with that, please? Let me gradually lead you to, as a French would say, raison d'être. What is that is the very justification for the existence of this product. Yes, MBBS is a dream for all of you. All of you there who is not, it's not only about learning, it's about life, learning life itself, isn't it? We will wind back to the June of last year. What happened? It's okay. It's okay. We will wind back to June of last year. Can you go further, because we are telling the journey so far? We will wind back to June of last year. How did it all start? We conducted research, we visited various medical colleges, and we also spoke to many medical students. They come with a lot of apprehensions like how much to study, how much hours to put in, and most importantly, I mean, that was really surprising, how many students actually fail in the very first year itself. No, we thought about all these, that okay, what should we do to make life easier for them, to make life convenient to them? We conduct, can you go? What? Yes. So with all this is what we have. Medace for basic sciences, which is digital, which is novel, and it's most importantly, it's for you, all of you in year 1 and year 2. And you will carry on? Yeah. Okay. So as I promised earlier, we will have another 10 minutes for the demo of this product. Over to you, Meghna.
As a student, I would have been lost if it weren't for my wonderful teachers to guide me through my medical biochemistry journey, right? We always look up to our teachers, don't we? Here too, our SMEs are here with you right from the time you start learning on our app. Let's start with our primers. Can you play that video, please?
No, go back. It's stuck. Can you play it? Give it. Okay.
Getting into the MBBS course means a shift from regular school teaching to professional course learning, which demands a lot of self-learning. One of the challenging subjects in your MBBS learning journey is physiology, which is the study of organ systems within the human body. Key issue that most students get lost in is referring to the various textbooks. Medace has a myriad of study material to provide you with an interesting way to learn and deeply understand this critical and foundational subject.
The student also needs to understand how this drug works in the body, how the human body handles it, and in what dose, formulation, frequency, and duration it needs to be used.
Welcome to the world of medical microbiology, wherein you will learn about microorganisms that can cause severe devastating illnesses leading to morbidity as well as mortality of the infected individual.
No, it's supposed.
Studying pathology as an undergraduate is more challenging due to its vastness and tough concepts. At Medace, we have made pathology super easy and interesting. CBME focuses on vertical and horizontal integration of subjects, and Medace has been designed according to these guidelines.
Now let me show you the real magic, the 3D models. This shows the structure of the human body in a 360-degree view for a better understanding of complex concepts. Our 3D models engage all senses.
The subject of biochemistry in first year MBBS is often challenging for students. Pathways to remember, cycles to draw, reactions to write, enzymes to remember. It sometimes gets too much for the new medical students.
Now that you have got a sense of what happens in a forensic investigation, deep dive into forensic medicine and toxicology to explore and solve many interesting cases. So, put on your thinking hat and happy learning.
Done? Okay. So now you know you are in safe hands, right? What is first year mostly about? It's about anatomy. Most of the students said that we practically live in our anatomy lab. We have more than 100 videos for you to explore and learn from. You can literally carry the digital virtual lab, digital dissection hall to your room, lie down in bed and watch a cadaver unfold from your bed, lying down. And finally, once you are done watching and learning, you can actually rest in peace. That's the beautiful videos we have. We have more than hundreds of them. Can you just forward?
When I was a student, I remember going to the anatomy lab and almost fainting. So it would have been great if somebody warned me about it. We have something. I'm just warning you guys.
Can we see a small glimpse of my...
Can you play it, please?
Called as the mylohyoid. The two-side mylohyoid muscles, they join in the midline at the mylohyoid raphe and goes towards the thyroid cartilage.
Let me cut and open the thoracic cage.
Let us have a look at these structures in the cadaver. What you see over here is the posterior compartment of the thigh and the gluteal region. You can also see that the gluteus maximus has been cut, and I would like to reflect it to show you structures deeper to it.
After dissection, what is this? Isn't it images and drawings? Yes.
I'll take this up. So, being a doodler and an artist myself, I've always, drawing anatomical structures and stuff was always hard for me. It was very difficult for me, right? So here we have all the images hand drawn so that it etches the sketch in a visual learner's mind and they can redraw it as is in the paper.
So, wait, can you just pull it down? Can you just pull it down? So as the time-honored saying goes, time and tide wait for none. With a humongous workload on your shoulders, the time management becomes very, very critical. We have created short micro-learning modules, as the panelists were discussing, with interactive and engaging nuggets, so that learning becomes easier and effective for you. Will you want to show some of them?
We have a 3D model. Can we play this again, please? It's okay.
No,
Here,
wait, let's see if we can.
we have interactive 3D models. They're captivating and insightful, and we have plenty of them.
We have cartoons
Here
too.
we have cartoon strips that will engage you and help you diagnose the cases confidently. Our professors explain the concepts with mnemonics and diagrams for longer retention.
And finally, the
And
quizzes.
finally, we have the quizzes to help you check your knowledge and your understanding.
However, the basic sciences journey cannot be complete without the idea of linkers. I'm borrowing a line from the popular Netflix series, The Good Doctor. It says, empathy is an invaluable motivator that truly connects the patients to the physicians. And this is what we have reinforced in our linker videos. We have created a plethora of them, and that will not help you only in communicating with the patients with empathy, but also help you arrive at systematic and correct diagnosis. Lots of things were discussed in the panel itself, isn't it? So let's see one of our linker videos.
Can you play this, please?
Hello, I'm Dr. Harshita. Me and my team will be taking care of your son today. Doctor, I'm really worried and scared. He's been fighting diabetes since a very long time. But it's really painful to see him in this condition.
So can I go ahead with the examination?
Yes, please.
I will first sanitize my hands. Can you look upwards? Downwards? Please show me your nails.
I have this nagging pain. My thumb really hurts, and now it's spreading to my index finger and the middle finger also.
Now don't say that I've been willing because of your pain.
So that was our linker video, and this is not all. The icing on the cake is our live tutoring and doubt clearance sessions. These sessions are conducted by renowned professors who will help you look at the complex concept with ease and confidence, and help you understand, answer your questions, and help you sail through your curriculum with ease and confidence.
Can you play this, please?
This is your first cranial nerve.
We have Dr. Tejasvi here.
First cranial nerve, which is the olfactory nerve. Then, the second cranial nerve you can make out here. This is your second cranial nerve.
Suspend animation. Voluntary. What is voluntary? Here, the person can control himself through his willpower. He can reduce his metabolic activity and he can fake death. In these situations, it is called as voluntary suspend animation. Who can do such practices? The yogic practitioners. Yogic practitioners.
So, to summarize, and in essence, you will see that with this product, learning is no more a daunting task. It will become a journey of discovery, growth, and enrichment. But the proof of the pudding is in the eating. So don't just take our word for it. Come and embark on this transformative journey with us. Happy learning. Thank you.
Thank you, ladies, for that wonderful, informative session. Well, ladies and gentlemen, we saw what was in the app. I'm sure you would want to know more about the behind the scenes, right? Well, ladies and gentlemen, we have definitely witnessed this dream which has come to a reality, but what we haven't witnessed are the efforts the team has poured in and the fun that they have had while doing so. They pulled in talents, ideas, and efforts all to make the impossible possible and the dream a reality. The phrase reminds us that when people come together, they can achieve more and that they could do and they couldn't do it alone. Well, then get ready to witness the magic that brought the Manipal Medace to life. You'll have an exclusive glimpse into the creative minds, the synergy, and the tireless efforts that have woven this dream into reality. So sit back, relax, immerse yourselves into the journey that shaped this revolutionary tool. Ladies and gentlemen, can we have the AV, please?
Hey, you guys are still here. Team's waiting. Come, come.
I'm Dr. Narendra Reddy. My name is Bharat. There are a lot of products that focus too much on tech and not so much on the education. There are few that focus more on education, but we wanted to deliver content with technology. Hi, my name is Johnny Storm. I'm part of Fantastic Four.
Myself, Gaurav Bajpayee. I am currently the head of sales for Manipal Medace. Super excited to take this product to the students and quickly reach out to all the 654 colleges.
MBBS students' journey without Medace.
Bad.
Journey with Medace.
Super exciting.
Hi, I am Anjita. I take care of basic sciences product. Getting the videos done, getting the learning design done, getting the technology up and running, it's been very challenging, but at the same time, very, very enriching.
Who has had the most sleepless nights?
They have given me 100 days deadline to complete entire content. 120 days I could complete. I don't know anything else to do. Building a product is my dream.
My name is Pratyush. The biggest challenges are to kind of start seeing yourself as a product company first. It's just people, processes, technology. Medace is doing really well on all three fronts.
With Medace, we have this really sweet spot, right? It's a culmination of legacy of backing of a large company and all that comes with it. But it also has the excitement and the fast pace of the startup culture, right? Very exciting and unique team to be a part of. Hi, I'm Preeti and I head product development.
Hardest part about studying MBBS is the curriculum. It is vast, it is huge, it is never ending.
Start using Medace because Medace is your one and only study button. It will help you both prepare and practice.
Start using Medace to score well. To be a better doctor,
It will be worth it if my learners are able to apply it in their day-to-day life and their learnings.
If we become the #1 player in the medical learning space.
All this will be worth it if students love Medace as much as we do.
Well, I hope you've enjoyed that captivating journey behind the scenes, behind the Manipal Medace creation. Well, this video was a testament to the passion, the hard work, and the shared commitment to revolutionize the medical learning experience. It encapsulates the heart and soul poured into crafting an app. Truly, we are all in this together. Well, ladies and gentlemen, it's an honor to introduce Dr. Narendranath Reddy. Well, a seasoned professional with a remarkable skill set driven by a strategic analysis and uncanny knack for planning, implementation, and control. He has been a driving force in the medical and dental e-learning industry, leading teams to consistently achieve targets. His problem-solving acumen, analytical powers, and exceptional people management skills have been instrumental in successfully overseeing multi-location teams across India. Dr. Reddy also brings a wealth of professional operational excellence and process re-engineering expertise to the table. Ladies and gentlemen, let's put our hands together and welcome the visionary leader on stage.
Am I audible? Yeah. Always. Oh. Thanks for the introduction, Tejasvi Kannan. Good evening, all. A warm and heartfelt welcome to all of you who have gathered here. I am Dr. Narendranath Reddy. It is both my privilege and honor to stand before this distinguished audience and discuss our shared aspirations. Why are we gathered here? Well, our goal is crystal clear. To give medical students a simple, intuitive, and amazing learning experience that helps them with their medical PG entrance journey. Fresh perspectives and cutting-edge innovation are the cornerstones of our mission. So how did it all begin? We kicked things off with one idea in mind to make things better for students. About 15 months ago, we took a good look at what's happening in the medical entrance landscape, found the best features that students might love, and dug deeper to figure out the pain points, their needs and challenges. We made a small learning plan and tested it with students. And you know what? We learned a lot from that. We found out where students need more help and came up with the smart solutions that address these key areas. The solutions were put together to the test again with the students, and this time results were even better. It is like making a dish by adding just the right ingredients to get that perfect taste, right? You must be wondering what are the challenges the students encounter. Well, let's take a closer look at from a learner's point of view and see how the Medace test prep product steps in to bridge those gaps. The first need gap we identified is lack of mentorship. We are fully aware that medical learning can be incredibly overwhelming given the vast amount of content that needs to be covered. There is an abundance availability of study resources both online and offline. And with all this information, students often find themselves a significant challenge. How to make this preparation journey more enjoyable and stress-free. Membership is often lacking, and that's why we try to introduce guidance through our study plans. Every student is unique with their own aspirations and goals. Our mission is to provide a tailored experience for each student by helping them realize the aspiration. Instead of bombarding students with more information, we worked on a personalized solution that distills the information. By understanding each student's learning pattern and the individual goals, we have created personalized study plans that cater to their shared aspirations. Let's take you through the study plan, how it has been created. On clicking Create Study Plan, you will see a brief note on how to create a study plan. Oh, I'm sorry. George, can you just go back? No, the video is not playing. Yeah, sorry for that disturbance, guys. On clicking a study plan, you will see a brief note on how to create it and for whom it is intended. You can begin by selecting 3 subjects for which selecting 3 subjects to add to the study plan. Then select the relevant chapter you wish to study for the selected subject. You may select all chapters or you can choose your personalized chapters. Then you can select the study components like must knows, nice to know, and may know. Here I selected must know. Then it displays the related resources to complete. It also displays number of days and number of study hours required to complete that study plan. You can choose the start date. By default, it is 10 hours. You can either decrease the study hours or increase study hours. Then system displays the schedule. Here still student can personalize when he wants to study each topic with the assets. It's done. He can continue with the second subject to create or go to home page and start studying. Yeah. Now let me call Dr. Tejashwi onto the dais to speak about second need gap. He is my anatomy faculty and QC master to the content.
Thank you, sir.
Oh, it's not on.
Yeah. Thank you. Hope I'm audible. Yes. Before I start, sir, how much time do I have?
Take your time.
Okay. This is the only time he has not given me a deadline. Right. So, we all know how overwhelming studying for PG entrance exam is, especially the stress associated with the changing exam pattern and also the plethora of content that is available online. Now, our belief is simple. Concepts are the key. If you master concepts, it is easy to conquer any exam no matter what is its format. Now, let's see how we have organized our assets or digital contents. Can we move on to the next slide, please?
Yeah.
Once we get started with choosing the test prep and clicking the learn option, we will see all 21 subjects lined one after the other starting from first year to final year. We can also see the number of topics and the progress made. Once we click on a subject, we'll get an overview video by the SME and followed by the chapters and topics listed according to the CBME curriculum that will help your learning better and lot more easier. And this also has number of hours of video, the notes, and also the MCQs that are there in each of the topic. Once you select a topic, there are videos lined up or contents lined up, followed by or arranged as must know component, good to know component, and may know components. Now, what is must know component? It includes core competencies and PYQs. Nice to know component includes all the non-core competencies, and may know component also includes non-core competencies which have never been asked in previous year exams. Then, once we come to the notes and the post QB, we have MCQs. Now, let's take a moment to pause at this. This is the handwritten notes that we have created, and these notes have been written by a doctor. Now, would you believe that if a doctor has this handwriting? In fact, this has been written by a doctor And this is one of our USP where we have presented notes in real handwritten format with multiple mnemonics, flowcharts, images lined up. Apart from what we are presenting with the notes, we have lined up previous year questions, which are like most of recall questions, the MCQs that are created by faculty, and these MCQs have been arranged in different difficulty levels. For example, 65% of the MCQs that we have designed are testing the problem solving and analytical skills, whereas 25% of these MCQs actually check the comprehension level, and about 10% of these MCQs actually check for recall level. And this has been done keeping the upcoming next exam in mind. Apart from the notes and the MCQs, we have created videos, and these videos are of short duration. And these videos, we have made sure that they are less than 20 minutes in duration, considering the short attention span of the students. These are the three main assets we would like to present in an organized manner for the benefit of the medical students. Thank you, and I'll hand it over to Naren sir.
Thanks, Dr. Tejasvi. As you know, any competitive exam prep is incomplete without proper assessment. This is a critical part in the preparation that completes the learning journey. Let me take you through a variety of tests we have on platform. Megha, video please. Yeah. It's not playing again. Yeah, we have got a variety of tests that are lined up, like subject-wide tests, comprehensive revision tests, grand tests, mini tests, etc. That helps you give the tools you need to gauge your progress effectively. Next slide, please. Yeah, now we'll move on to the more personalized corner of students, which is called My Corner in the app, where students' bookmarked assets will be available, like MCQs. I'm sorry for it. Yeah, the MCQs, videos, notes, flashcards, workbooks, the faculty connect and recent updates, even the offline downloaded videos. Now we move on to the last but not the least, the need gap, lack of reliable content. In competitive exams, there is no room for errors. Our content is exclusively developed and curated by experts with their extensive industry experience. They understand the intricacies of competitive exams and how learning should align with exam patterns. Rest assured, you are learning from the very best from the industry. Yeah. In addition to the great learning content, we also have engaging content through Faculty Connect and recent updates. Here, content will be related to spot diagnosis, interesting clinical cases, image-based quizzes, procedural videos, etc. Finally, we all know you are only as good as your team. Once Isaac Newton said, "If I have seen further, it is by standing on the shoulders of giants." I must say, there is one thing above all else that has made Medace possible, and that is our team of experts the faculty. Each SME was chosen with utmost care, evaluation and analysis. Our criteria went beyond expertise. We sought individuals who shared our dreams and aspirations. Now I would like to call my team onto the stage in alphabetical order. There is a guess question to my faculty. Can you guess who is the first? Dr. Abhishek. Yes. Dr. Abhishek Jha, Radiology. Dr. Abhirami, Physiology. Dr. Aditya, Forensic Medicine. Dr. Ajay Bhandarkar, ENT. Dr. Akshay Rao, General Medicine. Dr. Arpita Agarwal, Pharmacology. Dr. Daivik Sethi deals with orthopedics and physical medicine. Dr. Ganapati Hegde, Anesthesia. Now my senior most SME, Dr. Meenakshi Sundaram, Biochemistry and Microbiology. Senior most not by age, sir, with your experience. Dr. Nishant, General Surgery. Dr. Pushpa Kini, ma'am, Pediatrics from KMC. Dr. Ranjana Ranade, Pathology. Dr. Shimona Garg, Dermatology. Dr. Sonal Parihar, OBZ. Dr. Shravya, Dentistry. Dr. Tejashvi, Anatomy. Dr. Vidya, Community Medicine. Dr. Vinay, Psychiatry. And last but not least, Dr. Vineet Sehgal. Yeah, I'll go in the mid. I'll sit with the thing.
Ladies and gentlemen, this is the entire team up on stage. Can we give them a round of applause? And the team, can we see some poses, or anything that you want? Okay, at the count of 1, 2, 3, go!
This is not good. I don't like. Oh, mic is on. Sorry. Thank you.
Keep the pose on, keep the pose. Yes.
I'll do this.
This is your day, this is your night.
Yeah.
Congratulations to every single person up here.
Pardon? Yeah. Yes.
We'll have one serious picture and one fun picture. And now we'll have the fun picture at the count of 1, 2, 3, go! Yay! Yay! Well, the entire Medace team is here up on stage, ladies and gentlemen. Congratulations
thank
to
you.
each and one of you.
Preeti. This one.
Well, we all know by now that Manipal Medace is more than just a product. It is a constant companion, a buddy, and a guide from the moment the learner steps into medical school till the day
Outside.
they take
Sorry, I'm sorry.
till the day they take the NEET GP exam. We believe learners will quickly figure out that Manipal Medace is in this together with them, which is what our brand film is all about. It embodies our values of care, collaboration, and community. Without any further ado, let's take a look.
Aditya, friend Ara.
Now when do I do NEET PG prep?
Yeah, you're spending more time scheduling than prepping. Here, saved you 5 minutes.
I got you, buddy. I got you, buddy.
I'll make a heap of your troubles and blow them away like bubbles.
I got you.
Let's skip this also.
And if you ever feel
Listen,
lonely, I'll
first.
be your one and only.
I got you, buddy.
I'll power you up like mitochondria. Somebody trouble you, fight your chondria.
Yaar, I missed today's anatomy practical.
Take it easy, bro. It's all there on Manipal Medace.
Just schedule it on Manipal Medace now.
Just practice with Manipal Medace now.
You've got a new buddy to help you through NEET PG Prep and MBBS. Manipal Medace. Learn for MBBS students. Prep for NEET PG aspirants. Manipal Medace. In this together.
And we are here now. Ladies and gentlemen, with this we come to the end of this spectacular evening. I would like to invite Preeti up on stage for the vote of thanks.
Thanks again, Tejasvi. Ladies and gentlemen, as we come to a close of this evening, I'm filled with a lot of gratitude. Thanks again for being here. But you know, this journey wouldn't have been possible without all of the partners who worked with us over the last 15 years. So let me take this opportunity to thank them. Let me start with Ashish Thomas and his brilliant team at Valtech, whose vision and expertise brought the app's user interface and experience to life. Manju, Mahantesh, Dinesh, thank you for that. Bibumaya Mishra and the exceptional team at Happiest Minds, who built the application that stands before us for the 10 p.m. calls and the 4 a.m. ingestion runs. Thank you. Nitin, Subbu and the team at EI Design. Rajesh Bhatt and the team at Advisor Online for enriching our learning content with their creativity and expertise. Thank you. Naveen Raman and the team at 82.5, who masterfully shaped our brand strategy and the lovely film that you just saw. Thanks to the team. Venu, Samir and the team at Langur, whose guidance was instrumental in planning our media strategy. Ajit Pai and the dynamic MSL team, who worked tirelessly to amplify awareness about Medace. Abhishek and Rakshit from Vidu, the creative geniuses behind some of the captivating films we've seen tonight. And last, but by no means least, Gunjan Sharma and Sunetra Balal from Viscraft, whose magic brought this event to life. Thank you all for your invaluable contributions and your support over the last 15 years. Together, we're poised to achieve even greater heights. As we draw curtains on this event tonight, we invite you to explore the Experience Lounge that's now open. Thanks again for being part of the evening. Have a great time.
Thank you, Preeti. And ladies and gentlemen, if you turn around, the curtains have opened. The experience zones are waiting for you, and our team is even eagerly waiting to meet each one of you and show off the app. So all you have to do is go out there to our experience zones and take the first look at our app. Thank you so much for joining us, ladies and gentlemen. It's been a great evening. This is me, MC Tejasvi, signing off. Thank you and good night. Well, as you are walking towards our experience zones, we have a musical band up on stage, Pride Symphony.
I got you, buddy. I got you, I got you, I got you, buddy.
I'll make a heap of your troubles and blow them away like bubbles.
I got you, I got you, I got you, buddy.
And if you ever feel lonely, I'll be your one and only.
I got you, buddy. I got you, buddy.
I'll power you up like mitochondria. Somebody trouble you, fight your chondria. When you're pulling out your hair, studying at dawn, and have tears in your eyes from stifling a yawn.
I got you, buddy. I got you, buddy. I got you, buddy. I got you, buddy. I got you, I got you, I got you, buddy.